Welcome to the Practice of Medicine podcast from the Southern Medical Association. Since 1906, SMA has had a singular mission: to provide medical professionals with the resources they need to learn from each other, and in doing so, to improve the overall quality of patient care. The Practice of Medicine podcast is just one of the ways we do that, as we discuss a wide range of topics, including the Physicians in Training Day in the Life podcast series. To learn more about SMA's many other services and educational initiatives, please visit us at sma.org. Today, we are joined by Dr. Tracey Dabal, Chief Resident of Ambulatory Medicine with the University of Tennessee Health Science Center Internal Medicine Residency Program, and Dr. Chris Jackson, an Assistant Professor of Medicine and Associate Program Director of the Internal Medicine Residency Program, also at the University of Tennessee Health Science Center. They are discussing the safety of Baricitinib for the treatment of rheumatoid arthritis. Thank you for being here today.
Thank you for having us.
Yes, thank you for having us. We're excited to discuss this article.
We are very excited to have you. And just from a bit of a personal note, I have a couple of friends who have recently been diagnosed with RA, or who have had RA or have been diagnosed with RA for a while now. So from a personal perspective, I'm really interested in being a part of this conversation today. So thank you again for being here. Before we discuss the specifics of your meta-analysis, the results of which are going to be detailed in the May 2021 issue of the Southern Medical Journal, could you please share some information about rheumatoid arthritis, what it is, its causes, and who it more commonly affects? And then perhaps you can also talk a little bit about the use of Baricitinib for the treatment of rheumatoid arthritis.
Absolutely. Thank you so much, Ms. Price, for that question. Rheumatoid arthritis is an autoimmune disease that can cause joint pain and damage throughout the body. In general, the joint pain that we associate with rheumatoid arthritis classically affects the hands, usually on both sides of the body. But it should be known that it really can affect any joint in the body. And so it's very important that if you are having new swelling, pain, warmth of the joints of the hands or of any joint in the body, to make sure that you're going to your physician to be evaluated, appropriately. Now, rheumatoid arthritis currently affects about 1% to 2% of the population. As is seen with most autoimmune diseases, it tends in studies to affect women more than men. But again, that is just an observation from studies that we have seen. In terms of treatment, the first treatment for rheumatoid arthritis is generally with methotrexate, which is a disease-modifying anti-rheumatic drug, also known as a DMARD. And Baricitinib as a treatment is usually a kind of second or third line agent that can be used to treat patients who have rheumatoid arthritis that did not have a complete response with the use of methotrexate or other disease-modifying anti-rheumatic drugs. It should be noted that Baricitinib was not really mentioned in the previous rheumatoid arthritis guidelines published in 2014. Tofacitinib, which is also a JAK inhibitor, was mentioned in those guidelines. And it'll be very interesting to see with the current update in the guidelines whether or not they will make more mention of Baricitinib and its therapeutic role in the treatment of patients with rheumatoid arthritis.
Why did you choose to do this safety-focused meta-analysis?
Dr. Jackson, if you'd like to start, I can talk about how I got introduced to this project with you afterwards.
Absolutely. Certainly, the focus on safety was quite interesting. We know from multiple previous studies and even previous meta-analyses that Baricitinib certainly has significant data regarding its efficacy, both at doses of 2 milligrams as well as 4 milligrams in treated patients. What was unclear actually from previous studies was whether or not this medication was safe. As we know, patients on Baricitinib or other agents like it are often immunosuppressed either by the nature of having rheumatoid arthritis or by the medications we use to treat it. And that safety question actually was very relevant because when the FDA initially approved baricitinib here in the United States for treatment of RA, they only approved the 2 milligram dose. And their concern was that the 4 milligram dose had concerns around safety, specifically thinking about infections as well as the risk for thromboembolic events. And so my research group was interested in seeing, well, what does the safety data look like for baricitinib 4 milligrams? Since in most of the trials, it seemed that patients got a much more significant efficacious response with the use of baricitinib 4 milligrams instead of baricitinib 2 milligrams. And Dr. Dabal, if you want to kind of take it from there as to how you got involved with the project, please feel free.
Yeah, so Dr. Jackson and I have been working together with him as my mentor for a few years now. And I had approached him and saying that I have done case reports and was interested in trying to do a different type of paper. So Dr. Jackson brought this project to me that he had been thinking about and asked if I was interested in trying my hand at a meta-analysis. And I said, of course. It was definitely a great learning experience and has taught me a lot in looking at research in general when I'm looking at it for my practice as well, getting to see it firsthand and how you come to these calculations and these findings and these conclusions. So it was a really great learning experience for me.
As you went through the process of conducting this meta-analysis, as you went through, were there things that you found surprising or unexpected? Not necessarily the results, because I would love to know if you found any of the results to be surprising or not what you expected, or just validated what you may have already known. But were there any things throughout the process as you conducted the analysis that were either, like I said, surprising or interesting that you would like to share with us? Dr. Jackson, we can start with you.
Absolutely. I think from a research standpoint, certainly the length of time it takes to do a good analysis was something I wasn't previously aware of. There was a lot of going back and forth and making sure we've collected the data correctly and making sure that we've input the data correctly into our meta-analysis system. And so I appreciate the statement now, patience is a virtue, more after doing a project of this nature. I think the bigger thing I was surprised about with the results is that the safety concerns that were initially cited, while they are certainly still there, they were not as prominent in our analysis as I would expect. Certainly, when you looked at the rates of serious adverse events that led to discontinuation of the drug across the studies included in our analysis, there was not a statistically significant increase in those events with the use of baricitinib 4 milligrams as opposed to matching placebo. And I think this is very important because for practitioners and others who are treating patients with rheumatoid arthritis who are not having the response that they desire, either with methotrexate or other DMARDs or other agents, knowing that, we have an option in using baricitinib 4 milligrams in the properly selected patient, I think is great. And I hope that our study, albeit surprising, shows that while safety is, of course, still the utmost concern, maybe it is not as big of a concern as we initially thought. Dr. Dabal, do you have any additional thoughts there?
Yeah, I agree with you, Dr. Jackson. When we were looking at the 4 studies that we chose to include, there was definitely a trend towards placebo, looking at serious adverse events and adverse events leading to study discontinuation. But once we pulled the data and looked at it, there wasn't a statistical difference. And it really shows the strength of this meta-analysis in taking several studies that had low adverse event rates overall, and to get a really better idea of what is the safety profile of the 4 milligram dose. And I would also agree that it was definitely surprising, to say the least, how often we had to sit and reanalyze our data. And not doing one of these before, I assume, okay, we have our numbers and we put them into the calculations and we create these things. And and think that, oh, it's going to come out perfectly and now we can just analyze it. And it's like, no, you have to actually really be careful, really recheck, really take a step back, really have several eyes on it to ensure that you're being as accurate as possible, which is definitely an arduous process. But the more times we did it, the better understanding I had of everything that we looked at and the better understanding I had of how to analyze what we were coming up with.
Now that you've done this and you've conducted this analysis, how do you expect your findings to impact practice? Dr. Dabal, would you like to touch on that first?
Yes, I think overall, with new safety data appearing for this drug class in general, not just baricitinib, it'll be interesting to see if there's differences in the 2021 guidelines, which are currently under peer review. The 2015 guidelines discussed tofacitinib, which was previously approved, but the 2 milligram and now looking at the 4 milligram dose may come into more play with these new guidelines.
Dr. Jackson, any thoughts?
My mentee, Dr. Dabel, I think hit the nail right on the head. In the 2015 guidelines, there really was not a huge mention, if at all, of baricitinib. And so I'm excited to see whether or not they specify exactly how baricitinib can be used. It is my thought that likely it will continue to be, again, a second, maybe third line agent in those who have been on methotrexate and still have had disease progression. But we are still awaiting the new 2021 guidelines, and so I'm anxious to see the results.
Yes, in addition, I think it'll be interesting to see that now the phase 4 trial looking at baricitinib is planned to be completed in the winter of 2024. When we look at the studies we use now, the adverse event rate was low overall. So I think we'll have stronger data once we have those results as well.
On a bit more of a personal note, RA is a condition that does affect, 1% of the population. And with both of your involvement in internal medicine, is RA something that you're interested in pursuing? I mean, is this a key focus for each of you? Obviously, conducting this analysis, there's interest, but is RA something that you hope to go more into, or what made RA something that you wanted to research more?
I think the nice aspect of being a general internist is we get to deal with so many chronic disease and we get to see the whole picture of a person. And so rheumatoid arthritis affects so many facets of the patient's life. And so being able to really understand what options are available to them to help guide them is incredibly important. And from a personal note, my grandmother suffered from rheumatoid arthritis, and she had it at a time that the only treatments really available were steroids. And she suffered a lot of the consequences of having chronic steroid treatment. So it's just really exciting for both a personal note and for my patients that there are so many more treatment modalities available that have a better safety profile and that are more effective. And so they can be living a little bit more of normal lives.
Dr. Jackson,
I
sorry,
totally,
go ahead.
I totally agree with Dr. Dabel that, certainly for me as a general internist, arthritis is something that I see day in and day out. And certainly in my particular patient population, I have seen a lot of patients with rheumatoid arthritis. And so my personal interest in it is more that I believe as good general internists, we have to be able to be masters not only of chronic disease management, but looking at the literature in a very holistic way. And so being able to know, the different options that are available for my patients also puts me in the best position to be able to advocate for them, whether I'm talking to subspecialists about different options of care or following them up in clinic, once they're on these medications. For some of my patients that start these medications, they may forget to tell their rheumatologist, oh, I've been experiencing this symptom, or this is the effect I've seen, and being able to kind of be in the middle and help them navigate the process of living with this disease and dealing with the treatments that we use for this disease, I find an incredibly important part of my work as an outpatient internist.
Yes, I'd like to echo what Dr. Jackson said. Our patients are not reading the safety profiles. I mean, many of them are reading the side effect lists of what they can find, but really often they just have a new complaint and they're coming to their primary care doctor to say, help me, this is what's wrong, and not necessarily realizing it might be related to their treatment to bring it up to their rheumatologist. So it's really important for us as general internists to have our feelers out and to understand what things could be related to the different treatments that they're getting so we can help guide them.
It's interesting you say that, because one of my friends who has RA, she was always afraid to mention any pain or something that infection or anything that she thought was going on to her doctors, simply because she was afraid that they would take her off the medication, or they would say, well, you're no longer eligible to receive this. And, I would always try to stress, please talk to your doctors. This may be a side effect. This may be something that they can address while adjusting medication or possibly switching it. And so I think you brought up an interesting point, that you do need to communicate with your physicians, and because there's really no need to suffer in silence, as it were.
Absolutely. I want to piggyback off that a little bit, Ms. Price, that, one of the reasons we were so excited about the safety data that we saw in this analysis is because even though there were risk of infections and risk of adverse events, the fact that they didn't lead to individuals being stopping the study and or stopping taking baricitinib often lets us know that potentially we can team up with patients and with rheumatology to manage some of these more minor adverse events that occur if the patient is getting significant benefit from the treatment. And so I hope our analysis is also a starting point for looking at other medications, be it with rheumatoid arthritis, and asking the question that, we know that some adverse effects will be expected, but can these adverse effects be managed in a way where the patient can continue, their DMARD and, get the efficacy benefit while we deal with some of these small safety concerns.
As we've been discussing the study and the results of it, you talked about just some of the learning aspects of conducting the study. So I'm going to put on the SMJ managing editor hat for just a moment. And I'm going to put on my SMJ managing editor hat for just a moment, because I would very much like to get your thoughts on the publication process. We've talked about your study, but let's maybe talk for just a minute, if you don't mind, about how you got there. The SMJ has prided itself on being a platform for young physicians in training, to showcase their work. And knowing that Dr. Dabal is the chief resident, a physician in training, I would very much like for you to share your thoughts on the actual manuscript process. You touched on, developing the manuscript, and I would love for you to share just a little bit about how did you select those 4 studies, and what did you know to include in the manuscript, and just share. I would love to just get your thoughts on the whole process of submitting revisions, and what that is like from a physician in training, knowing you have so much on your plate as it is, just finding the time to work on such an important study.
Yes, thank you. So initially, I think a really important aspect is having a really great mentor. And I thank Dr. Jackson for really providing that for me. Learning how to do, especially something like this, a meta-analysis, which can be very intensive, and it's very important to be very detail-oriented from the beginning. It's really important to have someone who is able to guide you each step of the way. There were definitely several aspects where I felt like I understood how to approach a part of it and would complete a certain section, only to have to go back and start from scratch and realize I didn't quite do it correctly. But it makes you feel stronger in the end, because okay, now I've done this. I know all the ways I'm not supposed to do it, and now I know the way I'm actually supposed to do it. And so learning how to actually put it together from inception to submission was a long, arduous process, but definitely one that I feel like when I approach this again will be significantly easier and less intimidating. As far as submitting, that day that the first submission happens is so exciting. And you feel like, I've done it, I've made it, I'm there. And then you get back your first set of edits. And you're like, oh my goodness, it's really disheartening at first, because you're like, I've spent so many hours doing research.
It's like it's your baby, it's a child.
Yes, yes. And you initially think, you're like, oh, I was done. No, I hit submit. I'm done, right? And you're not. But after those first few days and lots of conversations with your really wonderful mentor, that's when you're learning, like, this is just part of it. And this is where it is the opportunity to take a step back and to look at the big picture and to say, okay, what did these reviewers see when they looked at this, and what parts were confusing, and what parts did they feel like were your strengths? And it's just a really nice way to take a step back and have fresh perspective on it. Looking at each revision as just someone trying to encourage you to have a better paper is just the better way to look at it, and to not feel like it's in any way a statement on the quality of what you submitted. It's just a way to perfect what you're working on. I actually had a conversation with my husband about this last night, about what the process is like. And, I told him, I was like, initially, I felt like like I said, it was very disheartening, but realized later it's really just another way to really look at your data, really look at what you're working on, and feel even stronger about it in the end. And he kind of laughed at me and said, he said, oh, so you're saying the juice is in the squeeze? And I said, yes. I think that was like a really long-winded way.
What a great way to say that.
The juice is in the squeeze.
Juice is in the well, I like that. Dr. Jackson, any thoughts from your perspective? You're a little more out from this, but just the process and everything. Is there anything you would like to add to that?
Absolutely. I think it is important to have an engaged research mentee when through this process. As Dr. Dabal mentioned, it's not easy to get those revisions back and be told that your paper has promise, but maybe is not where it needs to be yet to be published. And I think it's very analogous to where people are in their training, even as physicians, where sometimes we don't always get feedback that we want, but sometimes it is that constructive feedback that really allows us to develop into the physicians we want to be. And in a similar way, that constructive feedback allows us to take our paper, which might be wonderful of its own merit, and really turn it into something extraordinary. So for physicians in training who are submitting, their first or second or third manuscript, I know it can be extraordinarily frustrating when you put all this work in and then you get back, you have to do major revisions or you have to do minor revisions. But just like with anything else, things usually get better with time. And I will say that as Dr. Dabal, I, and the rest of the research team kept looking over this analysis and kept refining things, it got better. And I would say by the end of it, we all were like, wow, this is a really, really good paper. Probably much better than the initial version that we submitted. Another important point is that research in and of itself is a journey, and you got to focus on the journey and not just the destination. So for me as a mentor, not only was it great to be able to tell Dr. Dabal, your paper is accepted, congratulations, and to kind of have that moment of joy that the project is completed. But seeing all that was learned along the way, how to respond to comments from reviewers, how to, advocate for the work that you put in, how to, review a copy edit now that the manuscript is ready for publication. Those parts of the journey and learning, I think, are just as valuable, maybe if not more valuable than the acceptance itself. And so for those that are going through the process, remember it's about the journey, not just the destination. So make sure along the way that you are picking up the lessons that will help sustain your research interests and research career even beyond, this individual manuscript.
We've touched on several aspects of this study, including the actual clinical aspects, but then we kind of delved into the editorial and production side of what it takes to conduct and then publish the results. I would love to get any final thoughts, pearls of wisdom from one or both of those aspects from each of you. Dr. Dabal, would you like to start?
I'd like to say to other residents out there who maybe feel overwhelmed or intimidated by doing a large project such as this, to realize that having a great mentor is really important, and feel really comfortable with making mistakes and not knowing how to do things, and understanding, like Dr. Jackson said, that it's definitely a journey. The other thing I would say is, often we're very busy and there's a lot going on. And so you think of a project like this and it feels very intimidating, and there's more work than you're like, I'll ever have time to do. And really, it is just breaking it up into small pieces that are really approachable. Today, I'm going to take 30 minutes and I'm going to edit that introductory paragraph and make it into little bite-sized pieces that you can handle and take your time doing. And those are the tools that help me make sure I had time, even while being busy, being a resident and being pregnant and having kids and all of the things that go with those years of training. Really helped me to still be able to accomplish this and feel like the product is where I wanted it to be.
Dr. Jackson, any thoughts, pearls you would like to share?
Absolutely. I would really encourage all that are considering projects to think about a couple of key steps I think you can make to turn your project to where you want it to go. We've emphasized a lot the importance of mentors, and certainly in my work in research, that has been so important, to have a mentor that you trust and that you can feel vulnerable enough with to acknowledge when you don't know what steps to make next or what to do next. I think it's really important that you also have an accountability partner. And that doesn't necessarily have to be a mentor, but somebody doing similar work to you that can check in with you and say, hey, you're supposed to edit that introduction today, or hey, you're supposed to do this part of your manuscript. I think it's also important to recognize that, again, the journey is not linear. You might have to revise, you might have to send to another place, but one of my old mentors told me, every article has a home, you just have to figure out where it is. And so don't get disheartened if, even after putting in work, initially your article may not go where you expect it to go. I can share that, this journey with this particular article has been a 3-year journey, where we've really had to sit back and think about our research question and reframe and do things. And so don't give up on it. If you believe in your work, it can and should be published for others to be able to see. And so those are my final thoughts regarding just the whole process.
I cannot thank you both enough for spending some time today, not only to share your insight into your review, but also to provide some guidance and encouragement for young physicians who are wanting to submit manuscripts and to consider getting into that aspect of research and publishing. And so I think this will be very valuable. And again, I just thank you both for spending some time with us today.
Thank you very much.
Thank you so much for the invitation, Ms. Price.
We hope you enjoyed the practice of medicine. For more episodes in this series or SMA's The Business of Medicine podcast, go to sma.org/podcasts or subscribe to us on iTunes, Google, Spotify, or wherever you get your podcasts. For more information about SMA's mission, please visit sma.org. And thank you for joining us.